name is Dr. Guadamus, and we're going to start right at the top here. So I'm board certified by the NCCAOM, which is a national commission, meaning it's a regulatory board at the national level, and it certifies individuals who have done two things primarily. They've gone through a rigorous 4-year, 3,000 hours master's level degree program and have passed 4 board examinations. One that's biomedical, anything you can think of that is that would be a biomedical or allopathic or Western medicine medical exam, which would consist of A&P, which is the anatomy, physiology, pathophysiology, pharmacology, all the biochem, microbiology, and so on and so forth, as well as an acupuncture board exam, which will touch on the acupuncture anatomy, channel networks, needle technique, clean needle safety, contraindications, so on and so forth, as well as the herbal medicine board, which would consist of the contraindications for herbal medicine, the synergies that happen with herbs or herb interaction as we customize and formulate herbal concoctions or extracts. Excuse me. And then we also have a foundations exam, which consists of all the theories or all the theoretics of the of each of the subjects, so acupuncture, herbal medicine, integrative therapies, and what they emerge from. So what I do want to elaborate on here is that there's a broad spectrum in terms of who practices acupuncture at the moment in the US. So it varies from state to state because of the regulatory boards. Some states don't have regulatory boards. Some states have regulatory boards that we can maybe even say overregulate. Now, in the state of Florida, I'm licensed in the state of Florida, by the way, as an acupuncture physician. We are, by statute, primary care providers, meaning that we are like your GP, your general practitioner, your family doctor, who you would go see for pretty much anything that's not an emergency, right? So we would be able to provide or order labs and imaging. We can provide treatment. The difference is here, we would not do, obviously, surgery. We wouldn't be the ones in charge of vaccination, nor prescribe pharmaceuticals or narcotics. Everything we would do would be through integrative therapies, where it'd be acupuncture, herbal medicine, manual therapy, physical therapy, diet therapy, all of that consists of potential therapies that are on the integrative scope that do not deal with specific pharmaceuticals that are regulated and are within the scope of MDs in specific or DOs. Now, the reason why I wanted to touch on this was because the general public doesn't have very good awareness of what acupuncture is, even much less who to go to receive acupuncture and how to determine if the person is qualified or not. And believe it or not, even medical doctors or the healthcare professionals in the medical field have trouble with this as well. And at the very beginning, in the very first couple of years, I found this surprising. Fortunately, I've built many relationships over the years, and anyways, this is still an actual problem. There isn't a big awareness, and so many people don't know even if it's safe to send or to refer their patients to an acupuncture physician, because they don't know what kind of education they've gone or what kind of training is needed to provide acupuncture, which is it's a good concern to have, because within the spectrum of people that insert needles in you, there are big differences. Now, I mentioned to you that in specific to be NCCAOM board certified, you have to go through a 3,000 hour 4-year level master's degree program. This is the bare minimum to get licensed in the state of Florida as an acupuncture physician and to insert acupuncture needles and use it as a treatment. However, there are those other individuals in other states where there is no regulatory board, and just about anyone can put up a sign, that says acupuncturist and start using acupuncture to treat people. So it varies from, we can say, maybe zero training to 300-hour training to the 3,000-hour bare minimum training that we have in the state of Florida. And other states, many other states have begun to adopt the same kind of standard of having a master's degree level through a 3,000-hour program and having passed the board examination, but not all states hold that same standard. Now, additionally, I've acquired a clinical specialty doctorate in TCM internal medicine. However, that's specific to me, and it's just because of my affinity toward expanding my knowledge base and acquiring specialty and advanced skills, but it is not necessary to perform safely acupuncture, nor does it do we need to require it for state boards to regulate licensure of acupuncture. This is simply just a specialty, much like a neurosurgeon would specialize in neurosurgery after they've gone through their medical training. Oh, by the way, I did want to mention that the implications of having this gap, right? So for example, there are some programs out there that offer what they call acupuncture certifications, and there's really not much oversight on it, but they'll provide an acupuncture certification for someone having gone through maybe 300 hours worth of training on needling, and they provide this to the individual, and then the individual goes out there and starts practicing acupuncture. Now, what has occurred as a consequence of this huge gap and very variable kind of training, there's been very serious injuries and just events that have had severe consequences for patients. So there's been a couple very highlighted instances. For example, the one in the Olympics, there was an Olympian athlete who was unable to compete due to an injury from an undertrained acupuncture or someone trying to perform acupuncture. There's also been cases where they, even during a course where they were teaching, so I believe it was like a 300-hour training course, and the actual instructor who had received a 300-hour training course performed acupuncture and caused a pneumothorax. So there are some severe consequences of being undertrained and then performing acupuncture. However, I don't want to be an alarmist, because it's very safe if performed within how and what is supposed to be performed. There shouldn't be any cases where, or very minimal if at all, cases where there is a serious patient injury, because it is a very safe procedure, and it's just you are taught in, of course, a rigorous training. You're taught how to avoid harming the patient, causing injury, and avoiding these very dangerous and potentially fatal instances of puncturing organs and causing serious harm. So let's move forward.